Bismillah ar-Rahman ar-Rahim. Wassalatu wassalam ala Rasulullah. Assalamu alaikum rahmatullahi wa barakatuh. My name is Aisha Khan, and on behalf of the Muslim Unity Center's Education Committee, I welcome you all to our mental wellness series. Thank you all for tuning in to our virtual Friday night lecture. Hopefully soon, inshallah, we can have in-person programs. But until then, we can still meet virtually. Tonight, we are honored to have Dr. Edward Jouney talk to us about the basics of understanding addiction. This topic is something that is not discussed openly in the Muslim community. However, it is one of the most important issues to discuss, especially with our youth. Before we begin, I'd like to let our audience know that after Dr. Jouney's presentation, there will be some time for Q&A, so please send your questions in the comment section of Facebook and YouTube, and we will have Dr. Jouney respond to them in the end. All right, so it is my honor to introduce our speaker for tonight, Dr. Edward Jouney. Dr. Jouney is an addiction psychiatrist and assistant clinical professor in the Department of Psychiatry at the University of Michigan. He serves as the Associate Medical Director of the University of Michigan's Addiction Treatment Services and the Program Director for the Addiction Psychiatry Fellowship. Dr. Jouney completed his general psychiatry residency and addiction psychiatry fellowship at the University of Michigan and joined the Michigan Medicine faculty in 2011. All right, Dr. Jouney, so the platform is all yours, so take it away, please. And as I said, after your presentation, we have some time for Q&A, and then we can kind of, go for that.
Wonderful. Okay. Assalamu alaikum. Thank you for asking me to give this talk this evening. It's a pleasure to be here. I'm hoping that, after the end of this talk that those that are participating will have a better understanding of what drug addiction is. And I'm looking forward to hear your comments and to also listen to your questions. Okay, so let's get started. So
hang on, Ed, sorry. I think we are having a little muffled with your audio.
Okay.
So I'm not sure if it's the headphones. So would you be able to take your headphones off and try it?
I'll take them off. Sure.
Yeah, I think it was better earlier when we were talking about headphones.
Okay, is this any better?
Not exactly. Let's try one more time.
I'll move it closer. How is this? Is that still a problem?
Okay. All right, I think we good. So I see that Dr. Sabah Maruf said she can hear. So, all right, I think this is good, inshallah.
Okay, if there's any trouble with the audio, please let me know. I can try, and utilize another.
Right, and then, yeah, I think we have like Dr. Sabah and other people who are, so just give us some feedback, guys. So, okay, it seems it's good, so let's proceed, inshallah.
Okay, if there's any concerns, just please let me know and we'll certainly try and troubleshoot. So again, I wasn't heard before. I just want to thank everybody for asking me here today. It's a pleasure to be here. And we're going to talk about just the fundamental concepts of what drug addiction is. And again, I'll be certainly happy to address any questions and hear whatever comments may come about. The first thing that I want to talk about is the fundamentals, meaning what is drug addiction? Because this is something that is misunderstood. There's often a social definition, there's a social media definition, and there's a medical definition. So what I'm going to do is I'm going to give you the fundamental aspects of what this illness really is. So the first point that I have here is this: it is a set of behavioral and personality changes that is driven by the compulsive and impulsive use of chemical substances. The regular use of a drug or alcohol is only part of the behavior. And this is often a misconception. Many people view drug addiction as simply the compulsive utilization of alcohol or the compulsive utilization of a specific drug. That's only part of what the illness is. The other, more larger part of what this condition is significant personality and behavioral changes, and we're going to talk about what those are in a moment. It is a chronic condition. Again, this is something that is often misunderstood. It has episodes of relapse and remission, and this condition can be lifelong. Certainly, there are some folks that have just a brief episode of addiction that may last several weeks, several months, or maybe several years, but for the majority of our patients, this is a lifelong condition, and they have what we call a vulnerability. And that vulnerability is dependent on many things. It's dependent on genetics. It's dependent on their medical history, on their mental health history. But when somebody has this vulnerability, they are predisposed to reinforcing chemical substances. The last point that I have here is that this is a serious condition which necessitates treatment. Unfortunately, for some people, this condition can be fatal. Depending on the drugs that is used. If we take alcohol, for instance, alcohol addiction can certainly be fatal. It can lead to multiple health complications, the most concerning of which is cirrhosis, which is permanent damaging of the liver. If an individual is using opiates, such as heroin, they're at risk for acute overdose, which unfortunately leads to death. So the death from drug addiction can come very quickly, such as an acute opiate overdose, or it can be very gradual and can proceed along the length of years, such as we see with alcohol. The other subtopic here that I have is that if somebody is struggling with this illness, is that it necessitates treatment. You cannot expect somebody to stop. If somebody is struggling with alcohol addiction, opiate addiction, whatever the chemical substance may be, it's an unrealistic expectation to simply ask them to stop, and they will. This is something that necessitates medical intervention with a certified clinician who's trained in treating the problem or in a credentialed facility. We often get a lot of questions when I speak to religious groups of various denominations of, is this something, does religion have a role in it? And I would say absolutely, but it's not a cure. I think religion and spirituality can certainly provide support. There's no question in my mind that having a spiritual basis can help somebody through the treatment for this, but unfortunately, religion and social support in itself is not enough to cure this problem. Again, I think it's just important to emphasize the fact that this is a medical condition and it necessitates treatment with a certified clinician. Let's look at some of the statistics, and you have these here. This is a widespread illness that affects millions of people. If we look at the first bullet point here, the first point on the upper left, 130 people a day are expected to die of an opioid overdose. And if we're talking about opiates in general, which this slide is referring to, there's 10.3 million patients or people misused prescription opiates in 2018. So you see the numbers here are quite staggering. All right, and we see 47,600 people have died from opiate-related deaths. We can talk for a long time about the opioid problem because this has been in the headlines, and over the last 5 to 10 years, this has been the predominant substance that has caused the most havoc. Part of the issue is that not only is the drug readily available through illegal acquisition, such as purchasing it on the street or purchasing it from any other type of a drug dealer, is it's readily available through medical sources. And that's a whole other issue, and we can spend a long time talking about that. But when we talk about drug addiction, the opioid crisis is important because the numbers are so high and because of the lethality, meaning that an overdose of an opioid, morphine, heroin, whatever the case may be, can result in the individual's death. So what are some of the behaviors that we see? So as I said in the first slide, is that addiction is much more than the recurring and out of control use of alcohol or any specific drug. As we stated, that's part of the problem, but what I'm going to focus on this slide is the behavioral changes that we see. We see personality changes. So when you think of somebody that is struggling with a substance use disorder, which is the terminology we give in the business, it is a multidimensional psychological process, meaning that the individual goes through significant personality changes, behavioral changes that are driven by the use of a drug. You can see drastic and abrupt changes in mood. You can see manipulative behaviors that take many forms. We see lying. The individual cannot be truthful, and there's many reasons for that. And the lying can be quite convincing. When somebody has really developed in their drug addiction, they become masters of manipulation. They become masters at concealing the truth. There can be stealing involved. We see poor work and school performance. One of the hallmarks of somebody that is struggling with a drug problem in the adult population is we see diminished work performance. It just happens out of the blue. Of course, there's many reasons for that, but the use of a drug is something that we want to think about. We see poor decision-making, what we call self-destructive behaviors. These individuals have a lack of insight. And what that is they have an inability to recognize the problematic behaviors around them. So I listed all these things above, but the individual has very poor recognition of this. And when it is brought to their attention that there is a problem going on, they have the feeling they have it under control. It's under control. I can do this. It's not a problem. You're worrying too much. Don't worry. These other people have addiction. I don't. They may often justify their use, rationalize their use, is I have to have this. You don't understand the way my life is. I'm going through A, B, and C. Using this helps me. The doctors don't understand me. My family doesn't understand me. This drug is what I need. Yes, I understand I'm going through struggles, but if I didn't have this, things would be 100 times worse. And this is just an abbreviated list. So there's a lot more that I could put on the slide, but the emphasis that I want to point out here is that addiction is much more than just taking a drug. Now, I put here the certain personality and behavioral characteristics that affect the person. There is an equal number or even more that affect the family and anybody within arm's reach of this person. Drug addiction is not experienced in solitude. It is not experienced just by the individual that struggles with the illness. If we have a member of a family who is going to be affected, the mother, father, siblings, everybody who has some type of a contact with that person is going to be affected. It's not uncommon in our clinic for us to provide therapy to family members just as much as we provide therapy to the individual that is afflicted. So that's also something, to keep in mind. There are also support services, and I should have put them on the slides here, but we have treatment, of course, for the patients that are involved. There are also support services for families, and that's very important. So there's Al-Anon, and there's other support services available. So if anyone on the call, if you have a loved one that is struggling with a substance use problem, please don't try and navigate this on your own. You need support. There's support services out there, and I would encourage you to seek those out. So what is addictive? So we've talked about the illness, what it is. We've talked about some of the hallmark signs. We talked about, some of the physical consequences that it can cause. But what are the substances that cause this? Well, believe it or not, there's not many. There's actually quite a few. So if you look at, all of the substances, all the drugs that have ever been known to man, there's only a very, very small percentage of those that actually cause this types of behavior. The most common one is alcohol and tobacco, nicotine actually. Alcohol is, of course, addictive. We see prescription medications, most notably the painkillers, as we just talked about. So the opiates, these would be things like morphine, Dilaudid, oxycodone, Vicodin. These are all highly, highly addictive substances. We see the sedatives like Valium, Xanax, Ambien. We see the stimulants. These would include things like Adderall and Ritalin. So what's common amongst the drugs that I just mentioned? Well, they're all prescribed. So healthcare professionals do have a responsibility in managing this problem. Nicotine, as I mentioned, yes, if you're smoking, then you have an addiction. And of course, we have the drugs that are obtained illegally, cocaine, marijuana, heroin. Heroin, by the way, is an opiate. Heroin is very closely related to morphine. In fact, when somebody ingests heroin, whether it's they, do it through the nose, they do it through IV, your body converts the heroin to morphine. So with regard to the risk of heroin use, I have some statistics here for you. So if you use alcohol, you're 2 times more likely to be addicted to heroin. If you use marijuana, you're 3 times more likely. If you use if you use cocaine, you're 15 times more likely. And if somebody is prescribed opiate analgesics, they're 40 times more likely to be addicted to heroin. One of the things that I'd like to just backtrack on here a little bit is just to talk about marijuana, because this is such a hot topic these days. Marijuana is addictive. There's no question about that. So these behaviors, I'm going to circle back a little bit. So these behaviors that I showed you here, we see this with marijuana addiction. So the symptoms and the behaviors we see with other chemical addictions, including alcohol, opiates, we see the similar behaviors in people that are addicted to marijuana. Now, does that mean if you use marijuana, you're going to have an addiction? No. Just as it doesn't mean if somebody has a drink of alcohol, it doesn't mean that they're struggling with an alcohol addiction. Or if somebody is utilizing a painkiller, such as morphine, it doesn't mean they're going to become addicted to morphine. Only a certain percentage of individuals that use chemical substances will develop a true addiction. So marijuana is in the same boat. There was a study done, I believe it was done in the 1970s, where they looked at what is the percentage of people that use a certain drug that are going to become addicted to that drug. And the ballpark number was around 10 to 11%. I think marijuana was, between 9 and 11%. And what that means is that 1/10 of the people that are that use marijuana are going to develop an actual addiction to the drug. We certainly have people that use the drug in a more recreational way. We have individuals that utilize it for medicinal or therapeutic purposes. But there are people out there, probably 10 to 15%, that have a vulnerability to this. And if they use marijuana, they're going to develop an addiction to the drug and develop a lot of the behavioral struggles that I just showed you. Another thing that we see is now buying drugs online legally. Excuse me. The internet has brought us many things, and one of the things that it has brought us is an online marketplace. And you can buy a whole bunch of stuff. Now, the drugs that I mentioned in the previous slide are the ones that are very well known, the ones that are the most common, but there are a lot of other substances out there that are becoming more and more popular. And they evade regulation by the FDA because they're marketed as nutritional supplements. Right, so the FDA doesn't regulate them, and they can bypass those types of regulatory guidelines. So what I'm going to do is I brought up 2 common substances that are frequently purchased on the internet and we're seeing really widespread use. One of them is something called Phenibut. So this is interesting. Phenibut was actually a prescribed sedative that was used in the former Soviet Union, and actually still sees prescribed use in the former Soviet republics, mostly in Eastern Europe. But recently, over the last, 10 to 15 years, it has become a substance of abuse, and it has infiltrated Western Europe and has also found its way to the US. It has become analogous, it is analogous. It's very similar to a neurotransmitter we have in our system that's known as GABA. So GABA, G-A-B-A, that stands for what's called gamma aminobutyric acid. That's an amino acid. So because it's analogous to an amino acid, the FDA regulates it as an amino acid, which is a dietary supplement. So you can purchase this online, and this has been studied over the last several years to have significant abuse potential. In overuse situations, it can lead to significant psychiatric problems. There's been cases of people that have that have necessitated inpatient psychiatric hospital stays because of the use of this drug. So it can be quite problematic, but you can order it just sitting at your laptop, and that's quite unfortunate. So some of the symptoms of Phenibut intoxication, you could have people that are sedated, you could have a decreased level of consciousness, or they can become agitated, they can become confused, they can be delirious, they can have psychosis. In one of the cases that was written up, somebody came into the emergency room, they actually had to put a breathing tube in their throat and paralyze them and completely sedate them because they were so agitated. So this can be quite problematic, but we're seeing a rise of this. And these are marketed on the internet, as right here. So you can purchase this. And again, it's advertised as what's called a nootropic, meaning that it's cognitive enhancing. There's many websites that purchase. There are many online vendors, and you can buy this. The other thing that we're seeing quite commonly is something called kratom. This is a plant, and I have the name of the plant there for you. So it's native to Southeast Asia, and it contains the alkaloid mitragynine, and it can produce in low doses a stimulant type of effect, such as what you would get if you have a very strong cup of coffee, or it can produce an opiate-like effect in higher doses. We're seeing this used increasingly in patients that have a history of opiate addiction. Many patients are using this to help with opiate withdrawal. And there's a lot of online sources that will advocate its use. There's also a lot of YouTube videos out there that are advocating for its use. But we are seeing this as a problem. Where some individuals may utilize it in a recreational, occasional manner, we're seeing other people that can't control their use, and they're developing an addiction just like they would develop an addiction to any other substance. And as I'm saying here in the second bullet point, it's becoming increasingly popular in the US, and again, it's usually marketed as a dietary or herbal supplement, even though that it has quite potent properties, and people can develop a dependence and can develop abuse, as I'm saying here. And the information that I have here was taken from the Centers for Disease Control. And again, this was taken online. You can purchase this. Again, I'm not encouraging that, obviously. I'm just want to highlight this for you and let you know is that there's a lot of things that are very readily available that are evading detection and that are quite habit forming and can be both physically as well as psychologically hazardous. So the last thing I want to talk about is treatment. So again, just to kind of solidify the point here is that addiction is a medical condition and it does necessitate treatment. There's various forms of treatment. So when somebody comes into our clinic, the first thing we do is what we call the level of care. We have to determine what level of treatment do they need, because there's multiple levels. And I'm going to go through those with you briefly. So the first one, the most simplistic one, is outpatient services, which is just counseling. And patients may come and they may meet with a therapist regularly. They may meet in group. They may have weekly sessions. There's something called IOP, which is an intensive outpatient program that typically meets 3 times a week for anywhere between 3 and 4 weeks, sometimes longer than that. There's medications that are available, but very few. In fact, the only addictions that actually have approved medications are alcohol and opiate addiction. The other addictions we see there are medicines that are used, there's medicines that have been studied, but with regard to getting the seal from the FDA, there's only 2 addictions that have approved what we call pharmacotherapies. And again, that's alcohol and opiate addiction. The next highest level of care would be an inpatient program. This is, there's 2 kinds of inpatients. The first one I'm going to talk about is just detox. This is when you go to a treatment facility and they detoxify you off of the drug you're on. Typically, it's a short-term stay, anywhere between 3 and 7 days, sometimes a little longer than that. Some substances, especially alcohol, sedatives, and opiates, require a medical withdrawal because you can become quite sick if the individual just stops the drug abruptly. They can have multiple physical and psychological symptoms, and in some cases that may necessitate a hospital stay. Now, you can't have this done at any hospital. You should go to a treatment. You should go to a treatment facility. Most major hospitals will not admit for detox unless they're licensed to do that. So going, to Beaumont or to Henry Ford downtown, simply going into their emergency department and requesting detox, you probably won't get admitted unless there's a co-occurring medical problem that will warrant you coming in. They'll likely refer you to specifically to either a unit in the hospital that's specific for chemical detox or to a standalone detox facility, such as Henry Ford Maple Grove, the Brighton Center for Recovery. There's a chemical dependence unit in St. Mary's Hospital in Livonia. Those are just some examples. The highest level of treatment is long-term residential care. And this is, traditionally what is, when someone says rehab, I went to rehab, quote unquote, for 3 months. This is what they're talking about. This is a very high level of care. An individual stay in a residential treatment facility. It can be as long as 3 months. And these are high intensity levels of treatment because that's what is needed for that particular individual. These programs are all over the country. There's a couple local programs. There's Dawn Farm that is in Ypsilanti. You can go to high-end programs such as the Betty Ford Clinic in California. There's a facility in Arizona known as Sierra Tucson. There's the Hazleton Betty Ford system that has clinics all over the country. So there's multiple programs, and these can be quite costly. Some programs, depending on the nature of their services, they can be expensive as thousands of dollars a month. Sometimes $10,000 to $20,000 a month is not out of the ordinary. They can be quite expensive. But there's others that are much more modestly priced. And also the individual may need psychiatric care if it's needed. One of the biggest misconceptions that I see is that, people think that addiction is a psychiatric illness, and it's not. Certainly, individuals may have co-occurring psychiatric problems such as depression, bipolar disorder, but addiction in itself really isn't a psychiatric condition. If somebody has a substance use disorder, you can't just say, "Oh, you should go to therapy." Yeah, you should go to therapy if the individual is trained in treating drug addiction, but simply going to a counselor or going to a therapist that is not trained in the ailment is not going to be helpful to you. So many patients come into our clinic and they have standalone addiction. There isn't any co-occurring psychiatric problem. They're not struggling with a mood disorder. There's not an anxiety disorder. They're just simply struggling with a substance use problem, and there isn't any other co-occurring mental health problem. So again, when somebody comes in, we assess them and we determine what level of counseling is needed. We look at all of these and we determine what level do I put them in? Do they need to go inpatient? Do they need a detox program? Do they need a long-term residential facility? Or can we simply place them in traditional outpatient care? So if one of you were to come to our clinic, that's the first thing we would do, is we would determine where do you need to be placed. If somebody doesn't want treatment, it doesn't mean that we turn them away. We can work with them. There's some therapy services that are known as motivational interviewing. That's to work with a patient in an outpatient setting to hopefully move them along and get them to a point where they're going to want to engage in treatment. The other thing that I didn't mention that I should is probably vaping. So vaping is a mechanism by which somebody ingests a substance through an electronic device. And this is dangerous in the younger population because the young brain is still developing. So even if you're vaping nicotine, what you're doing is that you're exposing your developing brain to a very potent reinforcing substance. And this could lead to, you developing a propensity or a predisposition towards developing addiction to other substances. So when we see vaping, we certainly get very concerned. It's something that is not benign. So those are all the slides I have. Looks like I did it in a little bit under 30 minutes. Did I? Yes, 7:30. So I'm certainly welcome to address any questions or comments that may come about. And I think I can probably do this at this point. So I want to thank you for your attention. And again, I do appreciate the invitation this evening, and I'm happy to hear comments.
All right. Thank you, Dr. Jouney. I think that your presentation was very informative. I certainly myself learned a lot, and I'm sure our audience did as well. So especially I think the way you have included like all types of addiction, some of the ones that are sourced online, like the Phenibut, well, it was like all Greek and Latin to me, and it certainly is like help. Like I think what I feel is like just having this awareness is very important, just to be aware and to know what's going on, and then how to do this. So there are some questions that came in. So let me first address those. So I'll ask you a question, and then you could address those, please. Okay, you can hear me well, right, Dr. Jouney?
Yes, I'm sorry. Did you ask a question? Hello?
Are you there, Dr. Jouney?
Yes, can you hear me?
Oh, yes, yeah, we can hear you now. I think we had lost the connection just for like a tad bit.
Yes, I can hear you.
Okay, all right, there's one question that is, is dependency and addiction two different conditions?
Yes, they are. Well, it's a little bit of a long answer. I just want to make sure my audio is coming in okay.
Yes, they can hear well. Yeah.
Okay, so dependence means that your body has adjusted to a certain medicine or drug. So let me give an example. We see this with sedatives and with painkillers. So let me give an example. If we have somebody that broke their leg and they're in severe pain and they get put on Vicodin, and they're on Vicodin for at least 2 weeks or longer, you will develop a physical dependence to that drug. Meaning that if I withdraw the drug or if I stop it, your body's going to react. You're going to have a whole bunch of physical symptoms. That doesn't mean that you're addicted to it. It means your body, what we call, has habituated to that drug. Addiction is a behavior that causes the person to act in certain ways. If the person is just having physical withdrawal symptoms, that's not an addiction. So you can have somebody that is taking the medication just as prescribed. They're not exhibiting any of the behavioral problems that I talked about. They're compliant with their medicine, but they develop a dependence. The dependence on the drug, it's the way our bodies are engineered. In fact, if I put anyone on Vicodin or morphine, if I put you on this drug for a long time, your body's going to become dependent on it. But not everyone is going to develop an addiction. The behaviors of compulsively seeking the drug out, that does not happen with everybody. So they are two different things, yes. But somebody that is addicted will certainly have the physical dependence as well. If that's confusing, I understand that. Sometimes I talk to our medical staff, people that are physicians, and they also get confused. So, but I'm hoping that at least gave you an idea. Yes, physical dependence, you can have physical dependence and not have an addiction.
Got it. No, I think when you gave the Vicodin example, that really helped. And I think I had thought about that before as well, so it's a good question. Another one is that, so drug use in teens and college level students is reported to be high, of course. So how should worried parents what should worried parents do to help their students cope? And I think one of the things that the parents are also wondering, like, how do they know that, if their children are, undergoing any of these issues, right? Having drug problems, like what are the signs? And then also what are the, things that they can do to help?
Yeah, so that's a good question. We can probably talk another 2 hours just on that topic. So the first thing is I would try and have an open dialogue. And I would make the admission of use less intimidating. So if you're concerned about if someone close to you, whether it's a son, daughter, or loved one, if you march in their room angry, pointing your finger and stomping your feet and asking, are you smoking marijuana? I don't think you're going to get an honest answer. But if you go in there more of a concerned affect and basically say, I want to talk to you, I'm just interested in knowing how you're doing. I understand that a lot of kids may be using A, B, and C. I'm just wondering if you're one of those. And if you are, I want to hear about it, and I just want to talk to you about it. So I think the way you approach it is going to be helpful. Of course, I think, having a trusting relationship where you have that open dialogue is going to be helpful. There's certainly signs and symptoms that you can look for. That was in one of the previous slides. And just to summarize, drastic changes in mood, individuals making poor decisions, neglect of self-care. Now, these are non-specific. There's a multitude of things that can cause that. It could be coming from a mood problem. It can be coming from another psychiatric problem. So it doesn't mean they have a substance use problem. But that may be pointed in the right direction. The other thing is that you may not know, and it may be hard to know, because sometimes, depending on the individual, they're very good at concealing the problem, and it's very hard to a parent or anyone to detect that they're using. But again, this is a huge topic, and we can talk for hours about it.
All right. Yep, that's true. So thank you. And then let me see if there's a question here. So since you touched on the marijuana issue, and recently they've seen that there's such an influx of use in that, so does legalizing marijuana, does have, like, of course, a direct effect on that? Or the young adults, children, whoever the users are they really kind of thinking that since it's legalized, that it's actually okay to use, it's not actually a drug to get addicted to?
That's the concern that we have, is that, legalization normalizes it. And as I said, not everyone that uses marijuana is going to develop an addiction. But you have individuals out there that are vulnerable, and there's many reasons for their vulnerability. Part of it is genetic, part of it is medical, part of it is psychological. So in somebody that has a vulnerability, and it's probably anywhere between 9 to 11% of the population, yeah, they're going to develop an addiction to that drug, and I worry that the legalization is going to normalize that. However, let's look at both sides of the equation. Alcohol is legal. Opioids are legal. Hydrocodone, morphine, all these are legal, and we have a tremendous opioid problem. So the legality of the substance doesn't necessarily make it less or more dangerous. It's basically what its legal standing is. But I do worry that there's going to be normalization of it, and we may see an uptick in the cases that we see. I think not all the data is in yet. It's only been, I think, a couple years, so maybe a little more than that. So we'll have to wait and see. But yes, it is somewhat concerning. Okay.
And then also, just to kind of tag along that same question, then the continued use of marijuana, does that affect the the development for kids? Because as their brains are still developing, is that like a direct effect on the brain?
Yeah, absolutely. And I don't think it's not just marijuana. I would say any addictive substance, and marijuana is in that group. So I would say the same with nicotine. I would say the same with marijuana. I would say the same with long-term opiate use. If you're using these substances and you're an adolescent, I think you're priming yourself, and you're creating a neuronal environment that's going to be a very fertile ground for developing a substance use problem. And so it's concerning, because what we call neuroplasticity, the brain is developing, and it develops, I believe, up until the early 20s. So yes, it is certainly a concern. And as I showed in the slide, for individuals who are smoking marijuana, you're more likely to become addicted to other substances. But again, I want to emphasize, it's not just a marijuana effect. It's an effect of an addictive substance. And the same holds true, as I said, if you're smoking nicotine.
Got it. All right. Have another question online. How would you address parents or patients who hesitate to treat with stimulants because of potential, to ADHD, basically. So I'm going to rephrase the question. How would you address parents or patients who hesitate to treat ADHD with stimulants because of abuse potentially?
Well, I think it depends on the ADHD. It depends on how severe the ADHD is. Unfortunately, and I don't want to go on a tangent here, but there are some providers, psychiatrists and family medicine providers alike, if you go into their office and say, I got a C on my test, they're going to diagnose you with ADHD. So I think the first thing that needs to be taken into account is that, does the individual really have ADHD? Is this just a benign attention issue? Is it an academic issue, or is it truly ADHD? If it's truly ADHD and it's debilitating, then it should be treated. And even though that the stimulant may have an abuse potential, untreated ADHD, in my opinion, is far more worse. ADHD can be a debilitating condition. Again, if it's actual ADHD and they're having the impairment, they're having the inattention, they're having the profound distractibility, they're hyperactive, this can have really significant consequences, both socially as well as academically. So the advice I would give to the parent is, please ensure that the child or the adult, whoever it is, please make sure they have ADD. And this wasn't just a knee-jerk reaction, a knee-jerk diagnosis, because it is overdiagnosed and it is overtreated. But again, to summarize, if they have it, absolutely it should be treated, because untreated ADHD can lead to a whole spectrum of problems.
Got it. Thank you. All right. Another question that came from online is, can you speak to the impact of marijuana in Colorado, where it was legalized in 2012?
It's a good question. I don't know. I haven't looked at the data. I don't know what's coming out of Colorado. So unfortunately, I can't answer that question. As I said before, I am concerned that the legalization is going to normalize the use of marijuana. And my concern with that is that I think you have a vulnerable population out there, and there's going to be individuals that wouldn't have ordinarily used it, but they have the underlying susceptibility or vulnerability, and it's going to develop into a cannabis addiction. But I can't speak specifically about Colorado because, unfortunately, I'm just not familiar. I'm not too familiar with what's going on out there. I've been too isolated in my little bubble here.
Okay. All right. Another question, Dr. Jouney, is, let me know if you want to answer this, but what Islamic teachings would you recommend in dealing with any form of addiction?
So not specific towards Islam, but I think spirituality in general and having a spiritual grounding. I don't know if there's an imam or another religious scholar online that can comment to that, or rather, meaning comment with the specific Islamic philosophy. But I will say that spirituality in general is helpful. It's not curative. Having a spiritual backbone and, adhering to Islam and being a good Muslim, that's not going to cure the addiction. But having a strong spiritual base and having a spiritual footing will be helpful, and it will be supportive.
Yep, I think that's good. And then we can later ask our imam to address that as well. Another thing I just wanted to ask you, Dr. Jouney, is that the use of CBD oil, of course, it's different, but I know a lot of people are confused, and the use, there are many uses, it's been selling, but can you just touch upon the CBD oil, please?
Yeah, so CBD oil, traditionally, it's not psychoactive, meaning it doesn't produce any type of euphoria. It's not reinforcing, you don't get, the typical psychological effect you get from smoking marijuana. So we don't have a concern for it in the addiction sphere. With regard to its efficacy in pain management, I'm not a pain management provider, so I can't comment on that, but I knew that some people do benefit from it. The concern we have with CBD oil is, you'll have to excuse me, I have a little kitty here that's crawling. Well, okay. The thing we worry about with CBD oil is that it'll turn a urine drug screen positive for marijuana. So if somebody is randomly drug tested by their employer, or if they're in a certain type of monitoring program, for the Department of Transportation, or if they're a healthcare provider and they're in a monitoring program, utilizing the CBD will show THC, which is the active ingredient that's in marijuana. And that drug screen will be unable to differentiate whether that's coming from CBD oil or whether it's coming from the person smoking marijuana. But from an addiction perspective, we don't have a concern with it.
Okay, I think that was very important that you touched upon about the drug test, because many people, if some people are using the CBD oil, especially to cure pains and for other users, then if they have to do a drug test for a new job or any other, for any other reason, then that is a problem. And I mean, I really was not aware of that. So thanks for that information.
Sure.
Okay. I have one question. Doesn't THC, which makes marijuana psychoactive?
Yeah, so THC is the active ingredient in marijuana or cannabis. That's what's responsible for producing the psychological effects.
Okay. Oh, all right. So,
so CBD oil does not have THC. CBD oil is something else, but it will turn the marijuana screen positive. But it's not psychoactive THC that's in the CBD oil. It's another cannabinoid.
Yeah, I think that's what the question meant. Doesn't have THC. Yep. Okay. All right. I know. I think just a couple of minutes, then we can wrap up, inshallah. There was a question about some stats, I guess. So it's like, what are the statistics about substance abuse within Muslim communities? Are these addictions underreported due to stigma in the society?
Yes, absolutely. So I don't know the statistics within the Muslim population, but I can tell you that has certainly infiltrated the Muslim population. We see in our clinic, we see people from all faiths, including those that are Muslim and all other faiths as well. There is significant stigma, and it's not just within the Muslim community. In many religious communities, especially those from Southeast Asia, there is significant stigma associated with it. And it's very difficult for people to admit they have the problem. Most families want it kept in the household. So yes, there is significant stigma, but it's definitely prevalent within the Muslim communities. And that's why I'm glad you guys are doing this webinar, because I think that we need to raise awareness and to make people, more familiar with what's happening, because stigma and negative stigma is just not going to help the issue. Yeah, absolutely. So Dr. Jouney, if you were to address the youth, and if some of them are actually having these issues, what would you tell them, like what to do first, in terms of seeking help, using the different resources, so that they have some sort of confidentiality and be able to, seek help? When you mean youth, are you talking about somebody that's young? I mean, like somebody 15 years old, or are you talking about somebody that's an adult? If you can give me an age range, because that's gonna, well, let me just say.
Yeah, maybe I'm thinking 25 and under. Let just
okay. So the first thing, so anyone who is struggling with this problem, they need treatment. So one thing I can tell you definitively, if somebody is not in treatment, it is not going to get better. So if you have a son, daughter, if you feel or they're struggling with this problem, I can tell you without any question, it is not going to get better unless they get into treatment. And the reason why I say that is because I've worked with many families and many parents where they feel if they just talk to their son, if they just talk to their daughter, if they try and make them more religious, quote unquote, they feel this is going to go away, and it won't. It won't. It will not get better. It will only get worse. So if somebody is struggling with this, if you're the parent, you need to get them into a treatment facility. If it's somebody who is an adult and they can do this on their own, you need to get into a treatment facility. You need to call for help. And you need to call a credentialed substance use treatment program, such as Henry Ford Maple Grove, as I said, the Brighton Center for Recovery, Dawn Farm that is in Ypsilanti, our clinic, the University of Michigan Addiction Treatment Services. There's many clinics throughout Southeast Michigan, and you need to get an intake. You need to develop a treatment plan there. So you need to get in to get help.
Yeah, yeah, that makes sense. Just kind of like, pondering on that same question. So for parents, if they want to help their child or children, so is it first better to treat the addiction problem or understand what is it that's causing the addiction? I mean, is it anxiety, or are there issues, or what are the different first steps?
I think that's a good question, and I'm sure it's a common question that many people have, but no, you have to treat the drug addiction. I wouldn't spend any time trying to figure out where this is coming from. Leave that up to the professionals. If somebody has an underlying mood disorder, if there is some type of an anxiety disorder, that needs to be treated later, because addiction can be life-threatening. And if somebody is struggling with this, they need to get treatment as soon as possible. Now, granted, as I said, they may have an underlying mood problem. They may have an underlying psychiatric condition that's contributing to the problem, but it doesn't matter. They need to get in, and they need to get this problem treated as soon as possible.
Got it. All right. Yeah, looks like those were all our questions. Sorry, Dr. Jouney, you can, you're just hiding a little bit. Can you just move towards the center a little bit? Yeah, thank you.
Okay. Sorry.
Okay. Yeah, there's one other last topic. I think we still have a few minutes, inshallah, we can. So they're asking if you could, can Dr. Jouney briefly address porn addiction or problematic internet use, if within his scope?
Yeah, so we don't treat that in our clinic, but it is a problem. So pornography addiction, internet addiction, these are what we call behavioral addictions, and they do certainly exist, and they can be devastating. It can ruin marriages. It can cause significant family discord. These are problematic, and they need to be addressed. So again, that's not typically what I do in my practice, but I can tell you if anyone is struggling with that, then they need to get help. Because as with the chemical addictions, what we do know about the pornography addictions and about the internet addictions is they're not going to get better on their own. And typically, basic family interventions are not going to help. You need to get in to see a counselor. You need to get in to see somebody that is trained in managing these issues.
Okay. Right. So again, seek help to address that issue. All righty. So I think that's good. We do have, we had a good questions, and I think we are kind of at the end of our program. So Dr. Jouney, I think you really shared us very valuable information, and this definitely is something that in our communities we need to actually talk. So it's not I don't think this is the first and last time we are discussing these issues. However, we can start because for our Muslim Unity Center, we are doing the monthly mental wellness series. So talking about all sorts of problems and issues that can help our community. So thank you, Dr. Jouney, for your time, for all your valuable information, and for sharing us all the great knowledge, and giving us all the the resources that can help our community. Again, I think we probably will bring you again, on again, and hopefully, I really wanted to have an in-person program, hopefully, inshallah, post-COVID, so then we can, have audience, could be parents, youth, but it would be a really, good idea, and we want to have you over at the Muslim Unity Center.
Yeah, so thank you. And again, I want to thank you and the congregation for having me. Thanks for those who tuned in. I think it's great what you're doing. Please keep on doing what you're doing. It's great for us to have these conversations. I'm hoping what I provided was helpful to you. Yes, and I'll be more than happy to come back. I really enjoy doing these talks, and hopefully it'll be in person. I don't know about you guys, but I got Zoom fatigue. I'm just totally sick of sitting in front of a computer. So hopefully next time it'll be in person. So thank you again. It was fun, and I really enjoyed it.
Yeah, thank you. Yeah, no, I totally relate to the Zoom fatigue or virtual programs. And I think that's one of the, if we really want our youth and the young people to hear, they do like to come in person. And hopefully we can even have some pizza so they can just come and, enjoy some pizza with all of us. So thank you to everybody, online who have tuned in or are watching later. I think this is really valuable information, and it's something that as a community we need to talk and discuss and figure out how we can help if anyone's having any of these problems. So again, thank you, Dr. Jouney, and have a great weekend, and we'll see you.